public health globally, and certainly in Jamaica, is at a crossroads coming on the heels of the COVID pandemic. And the need to rethink and to reset and to recalibrate the approach to healthcare.
This was the driving force in 2023. We now review how public health and wellness fared in the last year. In 2023, the Ministry of Health and Wellness adopted a life-stage approach focusing on health promotion and preventing risk factors to ill health. The Know Your Numbers campaign went into communities with a target of providing 500,000 free health screenings to Jamaicans. A media campaign around the Nutrition Facts panel on food labels was initiated to encourage healthier choices.
It is important that Jamaicans learn to read and interpret the Nutrition Facts panel with its information on serving sizes, calories, nutrients, and percent daily value for the individual intake.
A national drug prevalence study and the Problem Management Plus initiative were launched to address mental health issues in the society. The opening of the $60 million teen hub in Morant Bay offered this age cohort another safe space. And there was a Champions for Change campaign tackling HIV stigma. The ministry also expanded the types of care offered in public health. The Animal Assisted Recovery Care Pilot Project brought comfort to pediatric patients. The New Limb New Life program was launched to provide an initial 200 Jamaicans with prosthetic devices. And thousands began receiving replacement dentures through a Second Chance Smiles program. Important policy decisions were taken in the year to increase healthcare capacity. Over 2,000 permanent posts were created for healthcare workers.
Permanent posts as opposed to short-term contracts for 789 doctors currently in the system. So we're moving from temporary to permanent, more job security. New posts of over 1,112 doctors to be filled over time, and 140 posts that were established to support the response to the COVID-19 pandemic.
At the same time, 25 intensive care staff received advanced training in neonatal respiratory ventilation therapies. A document to guide primary health care reform for Jamaica was tabled in Parliament. The e-health strategy was rolled out to revolutionize patient care using technology, while the electronic health records system was advanced.
In a very short phrase, it improves by reducing transaction time, transaction cost, and improve the quality of service provision for the patient in our public health institution.
In 2023, the 4 regional health authorities were each allocated $500 million for infrastructure improvement and equipment replacement, in addition to signing a service level agreement and receiving a medical equipment maintenance policy from the ministry. Also, a tender process was launched for the lease of advanced diagnostic equipment.
The first time that the ministry has embarked on a comprehensive, holistic approach to diagnostic services in the public health system.
Over $453 million was invested in new X-ray units for the Kingston Public, Bustamante, National Chest, and Spanish Down hospitals. Other cutting-edge equipment was acquired for several institutions. New ambulances were provided for the Western and Northeast regional health authorities. The National Blood Transfusion Service expanded its reach, adding mobile units and strategic blood donation sites. And contracts valued at $27 billion were signed to secure and improve the supply of essential drugs for patients. The symphony of progress in Jamaica's healthcare infrastructure continued in 2023, with the Cornwall Regional Hospital entering its final phase of renewal work. Construction of the Western Children and Adolescent Hospital soared to reach its 8th floor and closer to completion. Temporary buildings were constructed and other areas retrofitted and repurposed to make way for construction of a new 6-story 100-bed space at the Spanish Town Hospital.
This facility here, which will house lab services, pharmacy services, including waiting areas, testing areas, collection of medication, storage, is more than twice the size of what it was in its original place.
Spanish Town and the Bustamante Hospital for Children also received new beds. Black River Hospital got a new perimeter wall along with automated entrance and exit gates. The Maneeg, Broadleaf and Mandeville Comprehensive Health Centers were among the primary care facilities that benefited from upgrades. Construction also commenced on a new administrative building for the St. Anne Health Department. A new energy-efficient boiler system was installed at the Savannah Lamar Public General Hospital, and Black River became the newest certified baby-friendly hospital. The ministry was also responsive as a dengue fever outbreak posed increasing threat to public health.
We are on top of the outbreak, or certainly the situation, which involves all of us.
The Ministry of Health and Wellness in 2023 advancing the vision of healthcare for national development.